Hey guys, so day 30, AC joint separation. Got a lot of updates. I initially wanted to make updates every week. I know I did my first video when I was day 10 on this injury. So here I am, day 30. In my last video, I was saying I was going to get an MRI. I got the MRI done. It confirmed all the ligaments in the AC joint, they're all torn, which was kind of expected. I initially thought, hey, I'm just going to do conservative therapy, and that's the route I was going. And then kind of an interesting thing happened. I was working with my physical therapist, and he knows a shoulder specialist that does a lot of work in the Bay Area here in California. And so he reached out to him, and then now I actually have an appointment with this shoulder specialist on Monday. So really looking forward to that. Kind of interested to hear what he says. If he tells me I need surgery or he highly recommends it, I'll probably do it. If he says, hey, continue your conservative approach, that's probably what I'll do too. How am I doing? Well, on day 30, I have pretty much full range of motion, I would say, right? Yeah, I can move my arm all around. Moving it across and over, like over the middle part of my body, that still irritates me a little bit. So anything across the body, I can feel that. And so I don't do too much of that yet. But hey, anything out here, getting a lot more strength back. Still feels weak, of course, but it's getting better every single day. How's the bump looking? Well, I would say I'm very fortunate that it's not a very pronounced bump. My skin's really red because I just took the KT tape off. I've had this thing taped basically the whole time I've had this injury. As you can see, compared to the right side, I'm not injured on this side. And then there, yeah, you see, it's not too bad, honestly. I've seen some other injuries online, and gosh, I really feel bad for some of these guys that have like these really big lumps. I know it's cosmetic, but that would bother the heck out of me. I'll show you a front view here if I can flip the camera. I guess I can. Anyways, so I got that. I've been surprised. I haven't really lost a ton of muscle yet. It's been a month. I haven't really been working out upper body, of course. I did start doing some curls like this last week and worked my way up to 20 pounds again on this arm, which actually felt pretty good. So 20-pound curls again. I'm not really doing anything crazy. I'm not pressing over my head with any weight or anything like that. I'm going to wait on that one. It's kind of interesting because the physical therapist basically told me, hey, don't do anything. He doesn't even want me doing this right now. He says it'll help if I don't lift my arm over my head and I kind of keep it here and lower. It'll help build scar tissue and it'll be better in the long run. I don't know, man. I've seen so many different recovery stories online, and there's so many different trains of thought with this injury, which is one of the frustrating things. Is so much gray area on this injury, but I'm doing pretty well. The other day, gosh, it's probably 5 days ago now, I was able to do 10 push-ups in a row. First 5 or 6 felt pretty decent, and then those last 3 or 4, I could start to feel on the tip of the collarbone here. So I did that a couple days ago, haven't done any since, but I was able to do 10 push-ups on like day 25, which I'm sure my physical therapist and ortho people would not have been happy with me. But, sometimes we test these things out, and that's how it went. And yeah, it got a little sore after that, but that was kind of to be expected. What else? So, like I said in my previous video, I feel like, as you guys know who have suffered this injury, the pain's terrible the first time it happens, and that first initial week is really tough. But I think the psychological aspect still really tough. I do push on the bone multiple times a day, just subconsciously at this point. But I will say, it's getting better every day, right? As far as thinking about, the bump and all these different things. I'm very fortunate that mine doesn't really stick up too much, honestly. I mean, you can see it from other angles here. You just can't, you can't really notice it too much. I don't know if this is a good camera angle or not, but anyways, I'm pretty pleased with how it's healing. I still got a long ways to go. Right now I'm working modified at work. I'm an RN, so a really physical job. I have 2 more weeks of that, and then I might be heading back out to the floor. Of course, I haven't had to move any patients or do any like really heavy lifting, so If I was smart, I'd probably take another couple weeks off and really let it heal. But we'll see. Maybe I'll just kind of be really careful with this side and try to use mostly my right side for a while. But things are going really good. I guess at this point, the only kind of thing that could change what I'm doing is, hey, now I'm going to see the shoulder specialist and see what he has to say. I'm really curious if he thinks, putting a cadaver ligament, basically a dead person's ligament, and pulling this joint back down where it's supposed to be would be more beneficial long term, or I just have to hear what he has to say. I'm really thankful my physical therapist kind of helped me get a referral out to him, and I just really want to hear what he has to say. The only thing that will suck, of course, is I've done a whole month now where I'm starting to feel pretty good. Of course I still have little aches and pains, but I'm starting to feel pretty good, and I've also kind of come to terms with, hey, I'm going to get better. Every day's getting better. And I really feel like I'll get most of my strength back eventually. It's going to take time, of course, but I think I'm going to get most of my strength back. Range of motion's already pretty well there. So the only thing that would kind of stink is you have surgery and then, hey, now you're out, from what I've heard, 3 to 4 months minimum, because you're a lot of times 6 weeks, 6 to 8 weeks in a sling, really strict in a sling, right? And then you start just doing range of motion stuff, and that's at the 12-week mark. You do range of motion stuff at the 8-week mark. I'm sorry, for 4 weeks. Then at the 12-week mark, you would do weight training and try to get your strength back. So I'll just have to see what he has to say regarding that. Some things that are still really uncomfortable, like I said, pulling across my body. If I'm driving with my left hand, kind of doing what would it be, counterclockwise turn. When I get to here and I come down, that doesn't feel very good still. Just you can feel it on the tip of the collarbone. But everything's going pretty good, and I'm pretty happy, pretty excited about how things are going. What I tell any of you guys, hey, it gets better every day, man. The first week, gosh, I was a mess, thinking about this injury, when you think, hey, I can never do the things I want to do again, right? And you're looking at the bump and you're thinking about the pain and you have no range of motion and it's really tough. But things do get better, guys. They really do. And of course, I'll keep you guys updated after I'm planning on probably making another video on Monday after I speak with this shoulder specialist that I'm planning on seeing. But hang in there, guys. It does get better. I like to go golfing and all these other different things, weightlifting, and I've been swinging my golf club. Same, again, probably shouldn't be doing it, but I've been taking pretty full swings with the golf club outside. And man, I'm just excited that things are getting better every day. So hopefully it is for you too. Of course, if you have any questions or anything like that, leave it in the comments. If you're dealing with, dude, I get it. Psychologically, this is a tough injury, man. If you're dealing with any of that stuff, share it in the comments. I'll let you know. I'll respond to you, let you know how things have been going for me. Like I said, every day gets a little bit better, and you'll get back to what you're doing. But anyways, guys, take care, and I'll give you guys an update probably about Monday to see kind of which direction I'm headed with this surgery that I had. So, all right, see you later.